Indiana is introducing Medicaid managed care for people 60 and up. The state launched the Pathways for Aging program this month, which includes transitioning supports and services to managed care companies that charge a flat rate instead of the previous process of fees being settled individually. But as Benta Boutier reports, the changes have led to unanswered questions for caregivers, wait lists for patients, and skepticism for patient advocates.
For the past couple of years, this has been Matt and Jason Harding's routine. Every day, one of the brothers goes to their dad's house in Bedford. Right now, they're making his dinner. One of them also comes over every morning for breakfast. Their dad, John, has dementia. And as his conditions worsened, Matt and Jason have been increasingly worried for their dad. On Matt's days, he arrives around 5:30 a.m. before work.
We get here in the morning, get him his pills, get him something to eat, get him cleaned up. As of right now, he's got home health care workers kind of through a rehab process that come over.
John is just above the limit to qualify for Medicaid. Matt and Jason have hired legal aid to help with the paperwork to qualify. Matt says his dad needs help but isn't ready for a facility. Currently, that's the only option John has for long-term care services through Medicaid.
You're kind of in that middle range, which really, when you apply for Medicaid, works against you.
They can't afford out-of-pocket costs for assisted living, which runs around $3,500 monthly. 20 hours a week of home health aid costs around $2,700 monthly. The Hardings are among thousands of Hoosiers waiting to see what Indiana's new Pathways for Aging program brings, since it took effect July 1st and replaced the aged and disabled waiver. Matt and Jason want their dad to receive home-based care. They've been in touch with their area agency on aging.
If we can apply for home health care, that's great.
In April, the Family and Social Services Administration created a wait list for the aged and disabled waiver to reconcile a $1 billion budget shortfall in Medicaid.
The state just stopped, without any advance notice, approving waiver cases. And that included home health care and assisted living. So we had some cases that were already started and got stopped and denied.
The FSSA says it will start to process the more than 9,000 people on the wait list, which will take nearly a year. But Trace says there are many people who can't wait that long and might be forced to use nursing homes sooner than they're ready. The Pathways program replaced the state's fee-for-service Medicaid model. The state will instead pay a flat rate to managed care entities to handle long-term care and support services. Most of this was managed by area agencies on aging. Carrie Nowlin says they will still help with intakes for Medicaid programs, but communication with the state and managed care entities is minimal.
With any transition, you're going to have those moments where you realize we overlooked this, we overlooked that, but it really feels like there's a lot of gaps that were overlooked. I wish the boots on the ground folks from the AAAs had been more involved in the planning process.
She wants to know how area agencies are meant to notify a person's managed care entity that an evaluation for the Medicaid waiver is complete.
How specifically does it get transmitted, and will we get any further contact from the MCE, or is it just that we put in that placeholder and we're done? What paperwork do they need? There's just a lot of questions in our normal intake process that haven't been.
Nowlin recommends that anyone who anticipates they or a loved one over 60 will need care get on the wait list as soon as possible. She adds for people who need to take steps to protect assets, moving through the waiver process could take months. For Area 10, which serves Monroe and Owen counties, there are more than 180 people on the wait list. Matt says figuring out care in the recently changed Medicaid system for his dad has been extremely stressful for the family.
This guy took care of me for 20 plus years. I mean, it's the least I can do.
For Indiana News Desk, I'm Benta Boutier.